Hello all, this is Dr. Sue from Purely Pediatrics. Thank you so much for being with me. And I want to talk today about influenza. We are seeing a significant uptick in influenza in the infant, child, and adult populations throughout the United States and within our community significantly. I want to talk about influenza as a virus. And influenza is something that we do have two strains for, influenza A and influenza B. Typically, influenza A starts towards the beginning of the flu season, and influenza B tends to be more prominent towards the end of the influenza season. Symptoms are pretty comparable. With influenza B, we can see some more tummy signs such as vomiting and diarrhea, but generally we can see that with both influenza A and influenza B. I want you to know that we are able to diagnose influenza without a swab, so you do not necessarily need a test that tells you that you have influenza. As medical providers, we are pretty good about knowing when influenza is occurring. I do always recommend doing a COVID swab, and many at-home swabs are wonderful to use. So if you have them at home, it's always a good idea to check yourself or your child on days 2 to 3 of illness to make sure that you're not dealing with COVID. If it's negative and symptoms are continuing and they're pretty significant, we'll talk about the symptoms of influenza in just a moment. But as a physician, we generally can tell when influenza is rearing its ugly head. So I want you to know that you don't always need to pop on over to get an influenza diagnosis. With influenza, the symptoms include generally high temps. I'm seeing temps 103, 104, and those high temps can generally start within the first 2 to 3 days of illness. It doesn't necessarily have to show up immediately. And I want to use my son as an example here. He actually is just getting over influenza A, and he started off with some odd rib pain, just some real achy rib pain. We thought it was possibly just a muscle injury because he was at he plays hockey, and then it progressed into him just not feeling well, and he started to vomit. And then on the next day, we started to see the cold symptoms, the cough. We started to see the high temps. And so it can be an odd virus as well. Many viruses do start off with very ambiguous symptoms. Fatigue is also one of them that can show up. So I do see that as well. But symptoms of influenza can include cough, runny nose, headache, fever, vomiting, diarrhea, body aches. And I want to mention that there is something that I actually use just for my own knowledge. When I walk into the room and there's a child laying on the table, that's a really good indication that we may very well be dealing with influenza. Kids with influenza and adults typically just don't feel well, and laying down tends to make them feel better. Remember, every virus has a spectrum, so how one person responds to a virus does not mean necessarily that another is going to respond that same way. So we have mild, moderate, and severe symptoms with influenza, just as we have with every other viral illness. Influenza does have an antiviral that is available. Unfortunately, it's not always optimal, especially if we're seeing vomiting with a patient, as it can have a side effect that does include abdominal discomfort and vomiting, as well as diarrhea. We do have Tamiflu, and your pediatrician or your family doctor can talk to you about that. Usually it's something we can talk about prescribing if your child or yourself has been sick for less than 2 days, less than 48 hours. It tends to decrease the length of symptoms, not significantly, but on average by a day to a day and a half. There also is, for kids 12 and up, there is a one-time dose of a medication called Xofluza. And that is something, again, that can be given if the child or the adult has been sick for less than 48 hours. If somebody is sick for greater than that, the flu viral load is generally pretty high anyway, and those medications don't make too much of a difference. I didn't catch flu on my son early enough, so we didn't worry about the antivirals. But there is antivirals available for influenza, and that your doctor, your provider can definitely give you more information about that. Flu symptoms are something that can last just like RSV for quite a long time. You're looking at 1 to 2 weeks. The severe symptoms tend to start to diminish within that first week, but symptoms may not fully resolve within the first week and a half to 2 weeks. This is something that I want to make sure that families know, because generally when there is a flu diagnosis, whether it be via swab diagnosis or just a provider diagnosis, generally those kids miss quite a few days of school. My son has missed this whole week. And what you want to do is make sure that they're fever-free for 24 hours without medications, and that symptoms are generally resolving nicely. You don't want to send them to school with headache, with a cough that's consistent. You don't want to spread this to others, and you don't want to make it hard on your child too, because influenza does often make us feel pretty awful. So missing school is something that I want to make sure families understand that that's something they're not going to recover from within a day. And unfortunately, it's just one of those viruses like RSV that tends to hang on for a while. In terms of supportive care, something that will always be helpful is to be sure they are drinking fluids, and not just water. I want them to be drinking fluids with some electrolytes and some sugar. That's where we look at Pedialyte, we look at Gatorade, any of your favorite liquids that have electrolytes and some sugar in that is really going to be ideal. Generally with the flu and with many viral illnesses, we're just not hungry, we're not eating a lot, and we want to make sure that we keep our body balanced with sugar and electrolytes, just so we can heal in a much easier fashion, a much more effective fashion. And popsicles for little ones are awesome. Many adults don't realize that popsicles are great too, especially if you're vomiting. That's something, what I love about popsicles is that they're a small amount of fluid at a time. We're not swallowing too much, so it's not such a shock to our system if we are vomiting. Popsicles are a wonderful source of hydration, and you have your pick. Pedialyte makes popsicles as well, but they don't have to be something that you use, especially if your child doesn't like them and doesn't take them. So make sure to choose something that you will actually be able to get into your child. In terms of other supportive care, I want you to know that vomiting is something that your pediatrician will always want to know about. If it's something that progresses for, you're looking at over 24 hours of not being able to hold a good amount of fluids down, your doctor's going to want to know that. There are at times that we can order medications. There are at times we can give you much better recommendations personally to let you know what will work best with your child or your young adult right at home. So if your child is vomiting and it's something that just doesn't seem to be going away within that first day, please make sure you reach out to your provider to let them know that. Dehydration is something we want to prevent, and if we can't, we know what the course of action is, and we want to make sure families reach out for those symptoms. With regard to diarrhea, diarrhea is something that means that the patient is shedding the viral illness. We never want to stop diarrhea. We never want to use Imodium or anything like that, because that will disallow the body to actually get rid of that virus. So diarrhea is something we want to make sure that we continue to provide ample fluids, supportive care. Any of the medications over the counter that stop diarrhea, I always discourage use of those. Really in any diarrheal illness, I don't recommend use of those at all. But keeping hydration going, making sure that we are keeping a close eye on urination, intake, all of that is really important. Many times the flu doesn't involve the tummy, and it can involve more respiratory symptoms. So if there's signs of respiratory distress, if your child or your infant or young adult is showing signs of respiratory distress, tummy's moving significantly, chest is moving in and out, they're not able to vocalize, and they're not drinking, that's something I also want you to reach out for your doctor for. I talked a lot about that in the RSV video as well, and I often have families go to YouTube and search out respiratory distress symptoms. It's important to see what those look like because you won't always understand what we mean, and seeing the worst case video can let you know how your child is actually doing. If there's any question, you know your doctor is always available for you. Remember, we are always on call 24/7. Never hesitate to give your provider a call no matter where you are. We want to know, we want to try to help you to offer supportive care at home as best as we can. And if we feel that your child needs to be seen in an urgent care or an emergency room, we will let you know that as well. Before you pack your little one up to go to the urgent care or the emergency room, call us, please. Let us know. There's significantly long lines in every emergency room, every urgent care. If we can prevent that for you, then we would love to. And if it comes down to that we really need you to go, we will let you know that as well. So I think that's it for my talk about influenza. I hope that everybody found this helpful. And please feel free to write in the comments if there's anything that you want to add. I don't typically check the comments for questions, though I want you to know that I've been significantly busy making sure that I keep my own families and my practice healthy. So YouTube is something that I don't typically go to. If there's comments that you want to leave me for any requests for other videos, I'd be happy to take those under consideration. If there's anything you can add, please feel free to write in the comments. Again, with education and empowering parents, we are in a much better position to take the best care of our kids, and that's what we all want to do. Thank you so much, everyone. Have a great day.